and spoke with him last night, and I told him, you know, sir, you get the last word. And as we go around the table. But I listened in to the voice for about 3.5 hours today. Oh my God. Yeah. Oh my God. You know, and we have a lot to discuss. But I think the part that affected me the most were But Dr. Turbush, being the doctor, can also repair it. Can you hear me? Okay, great. Well, good morning, everyone. Let's go ahead and get started. Welcome to the El Paso County Public Health Board of Health meeting for October 26th, 2022. And looking around the room, we do have a quorum, and this meeting will be live streamed. Let's go ahead and do a board member roll call. Jack Briggs, General Jack Briggs, is excused. He's had a family issue, and there's Dr. Vu. And so he lost his mom just yesterday, so he'll be out, and we send our condolences and best wishes. And Fire Chief Ted Colas, I think, is hopefully going to be recovering because he just had some surgery, so he won't be here today either. Let's go ahead and do a roll call here. I'm here, of course.
Here.
Commissioner Bremer.
Here.
Commissioner Lojinos Gonzalez.
Here.
Councilmember Dave Donaldson.
Here.
Dr. Vu.
I'm here.
And Trustee Ron Stevens.
Here.
Okay, I think that's enough of us. The agenda is in your packet. You've had a chance to look at it. Any comments or corrections? Otherwise, I'll entertain a motion to approve in a second.
Move to approve.
Second.
All in favor?
Aye.
Board of Health comments. I will frequently wait until the last, but well, why don't I go ahead and do that? Doris, do you have some comment?
No comments today.
Okay, just kind of going around the room. Dr. Bill, anything?
No comment at this time, please.
Okay. Emmy, no? Huh?
I'm good.
Okay.
I'll continue the custom and no comments.
No comment? Okay. Lojinos?
I did want to highlight, but I think it'll be brought up later. But I did want to highlight that this Saturday there will be a drug take-back day sponsored by Communities That Care down in the Fountain Valley. But I believe Susan will be talking about it a little bit more in detail later. Thank you.
Yeah, that's a great thing. I do have a few comments. First of all, we had an education session plus a presentation, really, from each of our program leads last week, and a number of board members were able to attend it. I think it was useful. I hope so, and I appreciated Director Flynn setting that up and everybody together for that. Yesterday, I listened to the Board of County Commissioners meeting, and listened especially to Dr. Leon Kelly, our coroner, and his report. I just thought that was very informative, and would ask, if possible, maybe we could get him here in the future to do something similar for us, because it was just yeah. Okay. That's the end of my comments. The minutes are in front of you. You've had a chance to look at those. Okay.
I move to approve the September 28th Board of Health minutes.
Second?
Second.
All in favor?
Aye.
Okay. And President of the Council, Tom Strand, has just arrived, so welcome, sir. Thank you. Good, okay. Well, this is an opportunity for members of the public to go ahead and comment on any items that are not on the agenda. So any members of the public who would like, yes, please, come and tell us your name and who you're with, and you got 3 minutes, please.
Great. Good morning. My name is Stephen Walsh. I'm a proud resident. I'm not with anybody. I just kind of speak for myself. So I know we're all worried about COVID vaccine misinformation that's flowing around. So one thing I was really disappointed about that I didn't see covered on the national media or the local media was the New York Supreme Court ruling that came out in the last day or so. So if you're not familiar, they ruled that the vaccine mandate was ruled unconstitutional for their city employees and for all the employees to be reinstated with back pay. They also referenced that it was arbitrary and capricious, the mandate in the first place. So I'm just really curious why I didn't necessarily see that. So I'd love to hear comments on that a little bit later. And then something else that I would love to maybe hear some clarification on is the recent reporting and the testimony by the Pfizer executive that said when the vaccines were pushed to market that they were never actually tested for prevention. And that's kind of an interesting point too. So I'd love to hear clarification on that. And then finally, the last piece is with the booster. It recently reported that the booster was only tested on 8 mice before hitting the market. So that's something, just so I can get it straight in my own head, I would love to have clarification of which side is not necessarily telling the truth information.
All right.
Thank you very much.
Okay, any other members of the public who would like to speak on any items that are not on the agenda? How about online? Anybody out there? Corner? No? Anyone who wishes to speak virtually? Okay. Finance and budget. Samantha, and you're going to tell us a couple of things, right? We're going to talk about a resolution and then the September 22nd financial summary and also the 2023 preliminary budget. It's that time of year. Please, Samantha.
Good morning. So I believe you guys have the resolution before you to approve and recognize revenue for about, I believe it's $58,880. This is new funding we received to support the monkeypox.
Go ahead.
Good morning. I'd like to just share a little bit regarding this funding for monkeypox. This is time-limited funding coming to us from CDPHE. The funding will run through the end of December and will primarily support staffing for the monkeypox response to include staffing support for outreach to community partners, as well as additional nursing support for our reproductive health clinic, and as well as some limited clinical supplies and promotional materials related to the monkeypox response.
Okay, thanks, Deanne. That helps. Okay, I'm going to go ahead and read this resolution, and then we can talk about it and take a vote. So this is resolution subject to recognize revenue and appropriate expenditures for contract funding. Effective date today. Resolution to recognize revenue and appropriate expenditures in the amount of $58,880 for monkeypox and outreach grant funding as contracted with the Colorado Department of Public Health and Environment, abbreviated CDPHE. Whereas this project serves to control the spread of monkeypox in Colorado as the emergence of monkeypox infections in the U.S. and Colorado has resulted in an ongoing public health response. The project will strengthen and support El Paso County Public Health in its response to monkeypox, and whereas funding will support critical containment and prevention activities such as disease surveillance, case investigation, contact tracing, cluster and outbreak response, vaccination, testing, and community outreach and education efforts based on El Paso County needs and capacity. These activities will be performed in a way that promotes health equity within the county. And whereas the project benefits El Paso County residents by providing support to local health agencies in areas with increased monkeypox incident rates with the goal of slowing the spread of the illness and preventing new cases. And whereas funding for the monkeypox and outreach grant in the amount of $58,880 will be effective September 20th, 2022, and expire on December 31st, 2022. Now therefore be it resolved that the El Paso County Board of Health does hereby recognize this revenue and appropriate expenditures in the amount of $58,880 to the El Paso County Public Health budget in the following manner. We've got some data on the reverse side, which I'm not going to read all those things. And, but it's a breakdown basically by dollar amount of the way the money would be spent. So this is new money from the State Health Department. Any discussion up here, Board of Health members? Yes.
Yes, thank you. I know that we received a presentation on the specifics of monkeypox and in our region at the last meeting. I just wanted to verify that that the marketing expenses and all the other things that go into this are going to be specific to the audience that we know is at highest risk and not a broad. It's very targeted communication and response, correct?
Yes, that is correct. The promotional materials will be directed to communities at risk, as well as services provided within our reproductive health clinic that are geared directly to address individuals who may be at risk.
Thank you.
Yes.
Other board member comments or questions on this? Okay. Move to approve.
I move to approve.
Second.
I second.
All in favor?
Aye.
Okay, moving on. I think, Samantha, you have more.
I have more for you guys this morning. All right, so the next item is our September financial information. As we've kind of been going along and stating all year, some of our revenues are coming in under budget, but again, those are a lot of our reimbursement grants. We're also seeing the expenditures for those grants coming in under budget. So that's primarily why we are under budget on a lot of our revenues this year. Overall, though, we don't have any concerns as we move along. Questions for me?
Questions for Samantha?
Can I have a question, please? Thank you. I'm sorry I have a question about this almost every month. I think this is helpful, but I'm asking, do we think it would be even more helpful if we have, this is a year-to-date report, if we have a monthly profit and loss report for the year, or at least the last month P&L report?
Okay, we can.
I apologize. I guess that's both a question for you, Samantha, and for board members.
Okay, could you restate that form of a motion?
The question in my mind is, would it be also helpful, more helpful, to also include the monthly profit and loss report for the year, or at least the last month profit and loss report, for the purpose of comparison?
Well, maybe we could get some help. Thank you.
I'm Nikki Simmons. I'm the county's chief financial officer. Just wanted to step in, and usually in government services, a monthly report is not as helpful as year to date compared to where we do budgeting. There can be wild swings in a month because we can get grants that are for the whole year, and we get them in 1 month. And so usually if we do a month statement, we tend to kind of get lost in the weeds of that, and it may look a little bit different than the story that we need to tell, which is how we're doing year to date. And that's why you'll see when we do like January reports, they're a lot less useful than when we have like a full year going on. It is something we absolutely can provide to you, the information that makes up this month by month, but it's not something I would recommend spending a lot of time in public session going through, because it tends to not be as useful as the year to date compared to where we should be at budget year to date.
Thank you, Nikki. I think the year-to-date is most helpful, yes. But when I look at the year-to-date, and I have to depend on my mind to remember what it was like last month and the month before, etc. So I don't have a frame of reference what the trend might be, even though there might be monthly noise. If we have a longer more points of data for comparison, that would be more helpful in my mind than just to look at this. This is a slice in time at this time, and I don't remember the trend in the past.
Okay, absolutely. That's something we can work on. We'll work on with Susan to see what kind of reporting can help you follow the trends. I would still recommend that this be the primary thing that we focus on in public session because it's the most overarching, or we'll spend, I'm happy to have Samantha talk to you for hours about financials. But yeah, absolutely, we can put a reporting together that can help you understand how everything flows together month by month.
Thank you. You're right. This is most helpful, but this will be better interpreted in my mind if I have historical data.
Absolutely.
Yeah.
Thank you.
That sounds good. Thanks, Nikki. So maybe that could come out as part of the board member packet, some additional explanatory information for us to help keep track. And Samantha, you have another one for us, please.
So that's, the next item is your guys' 2023 preliminary balanced budget. So in this presentation, I'll be going over your historical budget. Just some items for review there, the current financial status, the overall budget process that we've been through this year, and then finally end with your 2023 preliminary balance. So this slide right here is showing overall, we've got the population of El Paso County over time, and then on the very bottom teal line, you're seeing ongoing funding for for public health. The green line that's kind of shoots off starting about 2020 is the additional COVID funding that we have been receiving. So I just kind of wanted to point it out, while our revenues and expenditures have been increasing, it's a lot of that is that time limited one-time funding for COVID. So this slide is another slide we show historically every year, and it is the overall trend of the staffing for public health. At this time, there's 158 ongoing staffing, and we have about 43 grant funded, again, time limited, specific funding or specific FTE for that. Next slide. Right, so this is your operational reserves, your current fund balance at the end of the 2021 year. At this point, you guys have $7.9 million in unassigned fund balance. You have about $500,000 set aside for emergency preparedness that the board has designated, and then about $200,000 we have to set aside for. Overall, the fund balance is about $8.6 million. Right now, the unassigned amount as a percentage of actual revenues for 2021 is about 25%. For the 2023 preliminary balance budget, we are proposing to decrease the fund balance just slightly by about $250,000. So this slide right here is showing you guys a little bit of history of the fund balance. What you're seeing is the green on top is the years that we've been able to increase, and then the red is showing the years that it has decreased over time. So this slide is showing the 2022 revenues year to date. It's very similar to what we just looked at. It is showing projected through the end of the year. While we did propose a $29 million budget, revenues are coming in slightly lower. Again, it's a lot of those that we're seeing. So I want to highlight that. The next slide. Moving into our budget process. So this is a brief overview of what we've been working with the Public Health Department and Division leadership over the last few months to prepare this budget for you guys. In June, July, we had a lot of preliminary meetings with leadership. August and September, there was a very thorough review of staffing. They looked at 6-month review of actual history, of actual expenditures, and then we also provided some budget training for any program managers that needed it. In September, we met with all division, all program staff, and we reviewed in detail everybody's proposed budget. We compiled everything, we went through everything really detailed, almost line by line. So in October, we reviewed it again with leadership. We had any additional meetings we needed with program just to kind of fine tune and tweak things. And then today I'm here presenting. So some of the other steps we've done included, again, we've reviewed the revenue for each program, again, program by program, reviewed what's happened in the past and what we're anticipating for 2023. Personnel, we did a complete review of the personnel list or the personnel staffing, ensuring everybody is coded where they should be under the correct program. Also for 2023, we also went through operating costs for each of the programs, put in the allowable indirect for which programs and grants are allowable, and then instituted any budget ballot strategies that were needed. So this is, back in 2019, Public Health had requested some additional funding from El Paso County for 10 critical need positions. These positions were funded through El Paso County Critical Needs Funding and with Public Health Board support. They were able to increase staffing in very key program areas, the emergency preparedness, environmental health, data analytics, and with the nursing. These positions were very crucial and were the first positions able to address and deploy for COVID-19 response. So it's just our ongoing gratitude and of support of El Paso County's Board of County Commissioners and you guys as well. We wouldn't have been able to done this without all of your support. Right, so other things is the increase in temporary staffing that we've had to do with public health nursing, epidemiology, preparedness. Again, this has all been funded a lot of times with that very time-limited specific grant funding that will be going away for the pandemic. So some of the budget challenges that public health has been facing over time is Paso County's population has had a large growth in the last few years, about 26% since 2008. As is mentioned, we've all mentioned public health departments that serve populations our size typically have 209 FTE. We currently have 158 with 43 grant-funded temporary. So with all of these, recruiting, hiring. All right. Recruiting, hiring, and training does not always follow or allow for that timely usage of that one-time restricted funding because it takes some time to bring this new staff in and get them up to speed. So that's part of what we've been seeing a lot of this year in the past couple of years as well. Another challenge that public health has been continuing to see is the increased demand for public health services across the board with a lot of their programs. Also, the capacity need to respond to emerging issues, such as they're coming out with COVID and other emerging issues that are coming up. And a lot of our grants are very restricted and very time limited. So this slide is showing, again, the population growth for El Paso County. The line below it is the ongoing support that we have been receiving from El Paso County. This does include some one-time funding that we received from El Paso County. The bottom line is showing the core support from the state. This core support from the state does not include any of the grant-specific funding that we receive for our programs, such as WIC and these items. So just wanted to kind of point out that item for you guys. Slide. Thank you. So some of our budget strategies that we've done to ongoing plans to address these funding needs is to continue to participate at the state level to and advocate for additional core state funding for El Paso County Public Health. Advocate through supporting legislation to increase state funding for our core public health services. A lot of times we don't receive grant funding for the core public health services. It's just the grant-specific, program-specific funding. And then to also strategize with our countywide partners to secure additional funding to meet emerging and continuing public health issues, to prevent illnesses and protect our citizens. So our revenue estimates do include overall revenue we are anticipating increasing about $945,000 for 2023. A majority of the increased revenue is, again, a lot of those COVID-specific programs and time-limited grants. And then we, again, went through each program, looked at each of the grants, all of the funding sources, program by program. The license fees and permits revenues, we are seeing an increase in those that we've been trending along all year, so we are anticipating that to kind of continue to next year. So overall, the revenue does include an additional $1 million from ARPA, 1.7 for CDC disparity grant, an additional $5 million for epidemiology and laboratory capacity grant, or ELC grants, 1.4 for additional immunization funding. Again, those are a lot of COVID, very grant specific, program specific, and time limited funding. The state, however, has their core funding has increased this year about $800,000. This is the second year of 3 years of increased funding. After that third year, the state has not made any guarantees on increased funding beyond that. All right. Some of the items that are included in the budget are continued support for meeting the increasing demands of public health, continue to address safety with emerging health issues. Continued support of the Board of Health to utilize savings as needed to address some of our unfunded needs, investment in public health human capital, and significant time-restricted limited funding to address the current public health safety issues. All right, so our expenditure estimates. So investing in human capital. Again, we've got that temporary increase to staffing to address the emerging health issues. Some minor program personnel changes. This budget does also include a 5% COLA and another about 2% allocation of personnel to help start addressing equities adjustments throughout. Overall, personnel does account for 66% of public health's budget. All right, so operating and capital cost overall, we're anticipating about $980,000 increase on this one. And that's just increase in our service contracts and ongoing maintenance and one-time building improvements for our new Public Health South building. And again, overall, we are proposing a $250,000 decrease to fund balance for 2023. So this next slide. So this is the proposed 2023 preliminary balance budget for public health, about $30 million in revenues and about $30 million-ish in expenditures. Slide. So if you compare to our 2022 revised budget, we are pretty on par, pretty close for where we're sitting this year as well. The next slide. So this slide is a breakout of the revenues that we are anticipating for 2023. Again, you can see a little over a fourth of the revenues that we are anticipating are those COVID-specific time-limited grants. Also from program-specific grants, those are again our very program-specific time-limited grants as well, detailing exactly what they can be used for. Next slide. Yeah. So this is just a really high-level breakout of the expenditures. Personnel, again, 66% of the overall 2023 proposed preliminary balance budget, with some operating and a little bit of capital. And then the next slide will break out our operating a little bit more detailed for you guys. So that includes our contract services, the utilities and facility maintenance, program services, and various other items. And then to wrap this up, almost done. So this is the budget timeline, budget calendar for you guys. In October 4th, El Paso County presented their preliminary balanced budget. The 18th and 20th, they received and heard their critical needs. October 26th is here today. I'm presenting you guys your preliminary balanced budget. In November, the Board of County Commissioners will be giving direction on their budget, and then December 6th, they will be approving it. December 14th, I will be back before you guys with a resolution to approve and adopt your 2023 budget. And my final slide for you guys, I just really wanted to point out and kind of highlight for you guys some awards your financial services departments that support public health have received on the public health documents. So the annual comprehensive financial report, that has received an award for the past 3 years in a row. They have submitted for 2021 and waiting to hear. And those awards are given to entities which succeed in the spirit of transparency and with full disclosure. Our annual budget book for the last 3 years, we have also won awards for, and those awards are also given for government entities for transparency and budgeting. All of these documents can be found on Public Health's website, and then the Government Financial Officers Association website is up there as well to give a little bit more information on these awards. One thing I will say for public health departments, there is a small handful overall that submit documents and receive awards on them. So you are part of a very small selective group. And do you guys have any questions for me?
Thank you, Samantha. And our Board of Health realized one of our core functions for our actions here, and you presented that very nice timeline. I also like slide 26, which shows the remarkable job that you've been doing. It's also been recognized. Director Whelan, did you have a comment about that?
Sure. I'd like to emphasize that, earning these awards and meeting rigorous standards takes a agency-wide, effort related to teamwork and how we prepare our budgets, how we go through each line item and justify the work that we're doing, and also, on the other side for public health, evaluating the work that we do. So I want to commend our Budget and Finance Office with the county, as well as all of our agency-wide team members, because we take our, funding very seriously, and with what we have, we do accomplish a lot for the community. So I think that is significant, that you have a health department, a local agency that meets rigorous standards, and it's not common among local health departments in the nation. So I think that is something that the Board of Health should be very proud of, and everyone who works on the financials and the budget. And to note that, the past couple of years have been very tumultuous related to receiving funding, getting grant funding, doing the work. And so to accomplish these, and earn these types of awards, I think it makes it even more significant. So thank you.
Good. Okay, we get two more chances to hear about this, November 15th and December 6th, before we actually vote on December 14th.
So yes, on December 14th, I will be back with a resolution for you guys to vote.
Okay.
And it will then become your original adopted
All
budget.
right. Well, this is a good time to ask questions and get the board's sense of what you think about our budget and what we're proposing for next year. So, any comments or questions? Commissioner Gonzalez.
Thank you very much, and thank you for the presentation. Very valuable. Want to highlight a couple of things, just of all the effort of by staff to go that goes into this, and by Susan. But I just want to emphasize how you've put us in a good position, and the efforts of the board the last several years to put us in a position, because we know that there's a potential economic downturn. I don't know what you want to call it, rebalancing after post-COVID and some of this inflation. We're in a good position. You mentioned the fund reserve, the reserve balance. So if something were to happen in 2023 that would change some of this, we have the flexibility there, or something were to happen in 2024. And so I do want to compliment, I know Dr. Turbush was really one of the people that really highlighted that several years ago on strengthening that reserve. And I think it's really postured us to really weather anything that might happen in the next year or two, because it can happen. And we want to make sure that this board and the public health department is able to get through anything. And I think that you guys are well postured, and this budget does that. Thank you.
Thank you. Other Board of Health member comments? Yes, please. Commissioner Brimmer.
Yes, thank you. And on the heels of Commissioner Gonzalez's comments, looking at this pie chart on slide number 22, just a quick cursory look as, really this budget, the revenues are quite dependent on 87% of it coming from outside what is generated here. And I think that's significant. I think it's significant to keep in mind that we're able to continue to perform a mission, but it takes an awful lot of partners and an awful lot of grants. And sometimes that the administration of those grants is maybe not worth it, but it allows us to get the job done for our citizens here. I think this pie chart right here just says it all, and also puts into perspective kind of the local commitment. And Samantha did a good job of highlighting what the El Paso County Commissioners have put additional revenue in year over year. I think, what are we in year 3 of a 3-year commitment to that? But I think that, just paying attention to where the revenue actually comes from is fairly important, I think, for this group. And I guess we maybe have a little bit of discretionary on about 14% of it at most. And other than that, it's empowering our leadership here at the health department to go and get those grants and to advocate for what this community needs with other organizations.
Other Board of Health member comments?
Yes,
please.
I have more of a question. First of all, I will commend the fact that we're doing a 3% increase. It's very conservative, which is a smart move given the recession time. And to Commissioner Gonzalez's point, the reserves are very healthy, and so I think everybody has done an excellent job. I'm new here, so this looks like a very healthy budget going forward. I guess my question is, El Paso looks like they're chipping in 26%, and then the grants are a big piece of our dependency. It sounded like earlier when we approved these grants that were coming in that they were reoccurring. How much of these grants are reoccurring in the sense of they're kind of the same thing on a how much have to be, like a brand new grant, have to just go out and look for it and go through the whole application process?
I would like to. So the majority of our funding comes from grants, and they are on all different fiscal years, whether it's a federal fiscal year, whether it's a state fiscal year, and some calendar year. And so we fit all of our grants into a calendar year, and they can be a 1-year grant, or they can be a 3-year grant. They are competitive. Even some of the routine ones like Tobacco Education Prevention Partnership, where we've had, maybe for, I guess that's like 2013, I may be getting the dates wrong, but we have to be competitive when we apply for grants. It requires us to explain what the problem is, specifically in El Paso County. It requires us to come up with a scope of work, an evaluation plan, and every single line item we have to justify, even down to, if we're any type of work, we have to provide like a calculation. So they are not, they can't be guaranteed to provide the service in El Paso County. And one of the challenges with grant funding is that it's categorical, and then sometimes it locks you into certain work and you can't anticipate being proactive. And what pops in my mind recently is some of the COVID funding. So for example, like if funding comes federally and it's for the emergency epidemiology laboratory capacity funding, and it's required to do contact tracing. And then in our community, there's not a need significantly for the contact tracing and investigation, and so we need to ramp that down. We can't just move that money without a long process to figure out getting approvals for that. So I would say that we do a fantastic job on going after grant funding. We are very aggressive with grant funding, and we appreciate those funds. But the challenge is for budget, for finance, and for our folks. And with Dr. Vu, related to like some of the reports, it is always a it's a big effort to manage all of those and deadlines and the requirements and the indirect rates, and they have a lot of differences. And I think that we do a really good job of that, but it is a challenge related to categorical funding not being as proactive as we would like, because it's a point in time when we're applying for those, and we have to meet those certain requirements, and then it's like for 3 years. So hopefully that answers your question, and that's why we're so grateful to the county commissioners providing the core funding. And then the state health department, what Samantha had presented is that we did advocate for increased state funding, and we were able to achieve that with the state legislature. We are in year 2, and they're on a state fiscal year, so that funding, additional funding, will run out June 30th of 2024, and that's where I need the board's help related, and that was a big part of the educational session to meet with our legislators and to help me make the case that we need that sustainable funding, because those are for the core funding, and that's where we can be proactive, because we need to be proactive as a public health agency rather than just kind of routine. We need to be able to flex depending on what is, what are the needs in our community.
Thank you. One more quick question. How does the county's portion get decided? Is that something that is requested from us to the county and then they approve it, or do they just say, here's how much we have in our budget to give you?
You want me to start off? Or okay. So I've been here for over 20 years, and the county has been very generous with us, but they have capacity and needs concern as well for the entire agency. So back in 2018, I went to the Board of County Commissioners to advocate or to request critical needs funding for the 10 additional full-time employees, and we got 5 out of 5 votes support from the Board of County Commissioners for that additional funding. So it is decided upon through a process of the county executive team, and I connect with Nikki, our chief financial officer, with all of the county executive teams, and we look at the budget as a whole, and we figure out like how, what are the needs, where does the funding get placed. But for an increase in funding, I have the ability to go to the executive team, make my case, as well as to the Board of County Commissioners to get support. But I guess to be a little bit more direct, counties are required statutorily to fund local public health agencies.
Thank you.
Yeah, so I can just expand just a little bit. So even though they're separate, public health is separate, independent board, they do come to us similar to another department would through our executive team and make a critical needs request. And so each year that gets reviewed and adopted similar to any of our county departments would, with increases based off the critical needs. In the last several years, as was mentioned earlier, I think we do a third year term of 3 year kind of emphasize additional funding to us. I would say that I think traditionally we're closer to about 21% of the funding, but with some ARPA dollars in there, you saw we're at about 26% of the total funding this year. But I think 21 is closer to the normal non-COVID ARPA fund federal dollars.
Other Board of Health member comments or questions? Yes, Doris.
It's comforting to know that we have the healthy reserve. I'm really proud of all of you for that and all the work that you've done. It is just concerning to me in the future, when you look at page 22, the COVID grants and the ARPA funding, that will eventually dry up. And so we'll have to eventually, there could be something new coming up in other grants, but that's a substantial amount of money. And so we'll have to be planning for how to replace that money in the future.
Correct. And, what we will be doing in 2023 is reevaluating the fees. And I know that you have brought this up before related to What are we charging for fees? What does it, cost us to do business? Because it has been a few years since we've done that, and we would not do that in a silo. We would do that with industry, with our partners to review those fees, and also with budget. I do need help to make the case for sustained funding from the state health department through the legislature. I think that is critical. When Samantha talks about nearly, it's 66%, nearly 70% of the work we do requires staffing, and we have to be viable as an agency and stay competitive. We have conducted a comprehensive salary study, and we are making progress, but I will tell you that some of the biggest challenges is that we face are recruiting and hiring and maintaining staff, and there's a variety of reasons for that. But if we're not able to recruit nurses and maintain nurses in some of the key positions that a local health department relies on, that's concerning. And so there will be a number of areas that I will seek board support, and whoever is available to come up to the state and help with sustained funding. And we have tremendous folks that are so knowledgeable about securing and searching for grant funding, but we need to look at all avenues to secure funding, because it's so important, especially as a growing population.
I also agree with Doris and with Susan that even though our days of cash on hand is healthy, the way I interpret our financial is we have an operational difficulty, specifically in the category of personnel, and the way to, I guess, there's so many ways, but one way to improve that is really funding so that we can increase salaries for our staff.
Yeah, and that's a major component is the staffing, and for all of the team members that we currently have, I want to keep, and there is justifiable information to do so. So that will be, that has been my priority. That will continue to be my priority with your support and also with our leadership team. That's critical, that we are healthy with our staffing. And that also goes to resilience and what they've been through in the past couple of years. And so we're doing multiple different efforts to recruit and maintain a healthy workforce.
Any other board members? This is a big enough thing. I'd like to open it up to people in the room. Are there any members of the public or elected officials who would like to comment on this preliminary public health budget? No? Any online? Okay, well, we'll see this again. The only other thing I would mention is that at our educational session, we got to meet some of the new staff that are helping to find those grants. We'll pull that money in. Samantha, do you have something else for us? No?
That's all I have.
Okay.
Thank you, guys.
Okay, thank you very much. Okay, next item on the agenda. Michelle, could you pass those out? You have these documents in your slide deck, but because of the font, they're almost unreadable. Well, I thought we'd pass these out just so you'd have some reference. And included are the, kind of in reverse chronological order, the El Paso County Board of County Commissioners resolution on Colorado Springs ballot issue 300 and 301. That was just passed yesterday. I believe that Commissioner Stan Vanderwerf was the sponsor. And then the Colorado Springs City Council resolution, and Councilmember Donaldson was the sponsor of that one. And then before that, going way back, the El Paso County Board of Health, we had a resolution not long after recreational marijuana became legal here in Colorado, and we were one of the first states. And this particular resolution that we passed at the time, and I was here for that. That was C.J. Moore, who was our Board of Health president. You'll see in there was extremely well researched, and we had good advice, good data, and good public health practices. That's where I want to start with my comments about this one, is that we, the Board of Health, see it as our mission to focus on the science and to focus on best public health practices, and we will typically stay clear of local political issues such as the Colorado Springs ballot issues 300 and 301. But you know what? There comes a time, and these are important times, and these are important issues. So we're going to go ahead and put our toe in the water, if you will, but remembering that best science and best public health practice is still our focus. I know that other board members will have a lot of comments. I watched the Board of County Commissioners meeting yesterday, and I thought what was most powerful were the personal comments from the Board of County Commissioners related to this issue. And I'd like to make a couple of personal comments myself. I really love our community, and I love the fact that we are not Denver. I'm on thin ice here, but I would say that the way that Colorado Springs has maintained its integrity on this, and seeing the effects of marijuana, widespread recreational marijuana in Denver, we don't want to be like Denver. The second point is that I had and have a childhood friend. I grew up with him. And we went off to different schools. I ended up in medical school. He was headed for law school for a law degree. And he became addicted to marijuana, and it ruined his life. But the big one for me, and I apologize, and this is coming from a perspective of many years in the military. I was part of a program called the Personnel Reliability Program, in what they call the kill chain for employment of nuclear weapons, and I had to do that multiple times, evaluating the physical and the psychological, mental, emotional health of not only senior officers, but junior officers, non-commissioned officers, enlisted people, all who were entrusted with the responsibility, the awesome responsibility of handling nuclear weapons. And all of us, take that part of the job very seriously. And I would say that in a roundabout way, but Mayor Suthers and others agree, and I know Councilmember Donaldson, you agree, this is a national security. And I think that if we go the way of Denver, that we would be less acceptable to Space Command as a home, that we would be less acceptable for defense contractors and all of those their clearances. And I think it will make leadership and management more difficult at the 5 military bases that we have. And I also look at 4,000 Air Force cadets that we have. So widespread availability of recreational marijuana, particularly in Colorado Springs, and it's the magnitude of change that they're talking about. So here's how we got there. Looked back in the archives, and sure enough, we had our 2014 proclamation and recommendation about recreational marijuana. And a lot of that good information we got from, we did our own research, but we also had Dr. Ken Finn, and he was just in the Gazette yesterday. But it was best science at the time. So we went back and looked for best science and best public health practice. Now, currently, 2022, and guess where it is? It's on the CDPHE, the State Health Department website. They have a commission sort out the very best available data on health effects of marijuana, and by strange coincidence, it's been written into law. It's partially funded by the marijuana lobby. So we use that data in our proclamation. I think that maybe just to kind of close this out is that we decided to combine that very best data and very best public health practice with a resolution that we are going to oppose ballot issue 300 and 301. And that's why I provided those handouts for you there, so you know exactly what we're talking about. But the bottom line is that it would massively increase availability of recreational marijuana, specifically in Colorado Springs. I know perhaps Palmer Lake has another thing going on, but I would just say it applies. So I'm going to go ahead and read the resolution as I do, and make a motion, ask for a second, and then let's go ahead and begin discussion first around the table. And I know that we have some members of the audience who would also like to come in.
Can I have a comment, Dr. Tovish?
Yes.
So, as a physician, I would like to voice my opinion to oppose recreational use of marijuana. Use of marijuana is associated with disability and with all-cause mortality, largely from accidents, suicide, and heart and lung conditions. Use of marijuana is associated with brain damage, demonstrated by neuroimaging studies, and use of marijuana is associated with development of schizophrenia. So I would like to formally, personally oppose use of recreational marijuana. Thank you.
Thank you. So reading this consolidated resolution to proclaim October 2022 as a National Substance Abuse Prevention Month, and a resolution opposing City of Colorado Springs ballot initiatives 300 and 301. Whereas, pursuant to the Colorado Revised Statute 25-1-5085A, the El Paso County Board of Health, referred to as the Board, has the authority to develop and promote public policy needed to secure the conditions necessary for a healthy community. And whereas, in accordance with the Fair Campaign Practices Act, specifically CRS 1-45117-1B3, the Board may pass a resolution and take a position on any ballot measure, question, or referred measure, and whereas the mission of El Paso County Public Health is to promote and protect public health and environmental quality across El Paso County, people prevention and partnerships, and whereas the vision of El Paso County Public Health is for all El Paso County residents to live in thriving communities where every person has the opportunity to achieve optimal health, and whereas National Substance Abuse Prevention Month, observed each October since 2011, highlights the vital role of substance abuse prevention in both individual and community health, and whereas substance abuse affects millions of Americans and includes underage drinking, alcohol dependency, non-medical use of prescription drugs such as fentanyl, abuse of over-the-counter medications, and the abuse of psychedelic substances such as psilocybin mushrooms, and whereas youth marijuana use has also become an increasing issue of concern in Colorado, particularly since 2014, when legal retail marijuana sales began. In 2021, calls to the Rocky Mountain Poison and Drug Safety Center regarding exposure to a marijuana product among children 5 years of age and older constituted 48% of calls, up from 17% of the calls in 2014. And whereas research has shown that for adolescents and young adults, marijuana use can be associated with suicidal thoughts or suicide attempts, weekly marijuana use is associated with deficits in cognitive and academic abilities, even 28 days after last use. And use of marijuana with higher THC concentration, that's the active ingredient, greater than 10%, is associated with continued use and future mental health symptoms and disorders. And whereas evidence also shows that adolescents who use marijuana can become addicted to marijuana, and that marijuana use in adolescents and young adults is associated with future use and use disorder for tobacco, alcohol, and other drugs. And whereas El Paso County Public Health provides valuable and accurate information and resources on its website to El Paso County regarding substance abuse prevention, focusing on youth substance abuse and opioid abuse. And whereas the board encourages individuals and families to educate themselves about the risks of substance abuse and to avail themselves of the community resources available for substance abuse information, prevention, and treatment. Now, therefore, be it resolved by the El Paso County Board of Health that the month of October 2022 proclaimed as National Substance Abuse Prevention Month in El Paso County, Colorado, and be it further resolved that the El Paso County Board of Health opposes City of Colorado Springs ballot initiatives 300 and 301. And I'd like to move that the El Paso County Board of Health approve that and would entertain a second.
Second.
Okay, now before going to a vote, we're going to have ourselves a discussion. And so we'll begin that around the table with our Board of Health members. But we have actually 4 MDs at least in the room, and we also have President of the City Council, Tom Strand, who I believe could make yes, sir.
I'd like to recommend maybe we let the public speak first, and that way when we discuss, we may be able to include maybe any answers or additional comments based on what the public says as well.
Brilliant. Let's do that. Let's go ahead and bring members of the public who would like to speak on this issue of substance abuse and the 2 ballot initiatives. Come right on up to the podium at this time. Anyone? Either for or against? Oh, okay. Yes. Councilmember Tom Strand, you're here in the public capacity. Yes, sir.
Let's see, I'm on members of this Board of El Paso County Health and President Dr. James Turbush. Thank you. I'm Tom Strand, and I'm here really as a member of the public. After serving at Peterson Air Force Base, actually Peterson Field in 1975, I came back in 2005, so I've been back for 17 years after finishing my Air Force career. And I'd like to comment on this. It was sort of interesting. When I was here in 1975, I was actually a defense lawyer in the United States Air Force, where I would defend airmen, both enlisted and officers, at courts-martial. And I remember vividly in those days that if an airman, whatever rank they were, was caught with any marijuana substance at all, and they would be prosecuted, they would go to a court-martial, and they would get 1 year in jail. And so you fast forward to 2014, and here we are with our state legalizing marijuana, recreational marijuana. I want to comment, and I know the county commissioners, and I know you both will comment, Cami and Lojinos, on what happened yesterday, but we had Councilmember Donaldson about two weeks ago, I think, bring up before City Council a resolution which opposed these two issues that are going to be on the ballot. And by the way, we're 2 weeks away. You know, we're 14 days from yesterday away from the 8th of November. We had a lot of debate in City Council in chambers. We had a lot of public comment. Ultimately, 6 council members voted, in favor of a resolution opposing both of these items on the ballot, 300 and 301. So it wasn't unanimous. It was a 6-3 vote with a lot of discussion. I personally voted in favor of the resolution, and I'm going to tell you 3 reasons why I voted in favor of the resolution. The military always has 3 that we try and do with most things. Number 1, I have been on school boards since 2005 or 2007, so for 15 years I have been on school boards either at District 11 or with my charter school that I'm on now. I think that if this issue 300 passes, allowing recreational marijuana to be available at 114 medical marijuana facilities within our 200 square miles, that will provide access to all of our young people. I know you have to be 21 years of age to purchase marijuana, and that's in the statute. But my fear is that if we have 114 facilities, access will provide marijuana to people in high school and middle school. And I'll use a quick story. When I was stationed at Biloxi, Mississippi, I remember a police officer knocking on my door, and my 14-year-old son, Micah, at the time was in tow, and he and 2 other friends had elicited an adult to buy beer for them. And so even though they needed to be 21, they found a way to find someone that could buy that substance for them and provide it to them. So number 1, my fear, if this passes and we have access at 114 legal facilities, that will find its way into the hands of our young people. Number 2, I have had a chance to talk with the commanders of all of our military installations, the wing commanders at Schriever and Peterson Space Force Base and Cheyenne Mountain, as well as the superintendent of the Air Force Academy and the garrison commander at Fort Carson. All of them believe that if we allow marijuana, recreational marijuana, to be sold within our city limits, it will affect their airmen, their soldiers, their sailors, and their space folks. So, they are concerned about this very much, and they feel that if we allow that to happen, we are going to have more issues with our military personnel having access to marijuana, having it affect their duties, and having it affect their careers. Finally, we are a defense community here. We have a lot of businesses and operations, and I think, Dr. Turbush, you kind of commented on this. Many of us have had high security clearances. I got a top secret SCI clearance. I know there are higher security clearances, but to have jobs in our defense communities and businesses here, you have to be able to have a clearance, a security clearance. If you are using marijuana, you will lose that clearance. So it will affect the ability of many of our people that live and work here to have jobs with our defense community. So those are the 3 reasons I'm asking all of you to consider this resolution that's before you today and vote in favor of it and against having recreational marijuana sold within our city limits. So I'm available for any questions if anybody has any questions. Thank you very much for letting me address this august body. Thank you.
Thank you. Well, let's go ahead and begin over here. And Councilmember Donaldson, please.
Yeah, thank you, Dr. Turbush. And I also want to thank President Strand, who he encouraged me to go ahead and proceed forward with that resolution, which we did pass on City Council. At City Council, we had 4 speakers come before us, because what we didn't want to do is just sort of have our opinion as citizens, the 9 of us. We wanted experts to come in front of us, one of which was Dr. Ken Finn. And I would if we have the opportunity in the next month or two, I think it'd be great for him to come here and give us a presentation on current thinking. And he was unequivocal, this is a bad idea to make it marijuana even more accessible in the city of Colorado Springs. He expects bad things to happen if it passes. One example he gave, this is historical, is Memorial ER has lost $20 million in uncompensated costs incurred by cannabis or marijuana presentations in the ER. So that's just one thing that's going to impact our medical community. Another speaker we had was a Mr. Dave Daslich from the Colorado Springs Chamber of Commerce, and he's a governmental affairs person, and he spoke that they truly believe this is going to impact our ability to attract defense contractors to Colorado Springs. So it's going to have an economic impact on our city. Not my opinion, not President Strand's opinion. This is our Chamber of Commerce, the governmental affairs experts. Third speaker was our district attorney, Michael Allen, who feels this will cause an increase in crime. Everybody's entitled to their own opinion. This is our DA who studies this stuff closely. He believes it will. This is a wrong time to do this. We already have a crime surge in Colorado Springs and Colorado. And fourth, last but not least, was our very own General Jack Briggs, who spoke about his experience at the Springs Rescue Mission. And one of his statements was, not everybody who uses marijuana becomes addicted, but all the addicts of drugs that he meets started with marijuana. And in his experiences, again, this is a bad idea. So those were our four speakers. And a thing that one of the whereas clauses in our resolution we passed on City Council talks about, right now Colorado Springs is like the #1 destination in America. It's the most desirable place to live. That can be jeopardized, and we can start to go downhill. Denver has slipped in those rankings consistently over the last few years. Pueblo also has recreational marijuana sales in their city, and their quality of life has declined. And we expect on City Council, those of us who voted for that to happen if this passes Initiative 300 and 301. We had a retired Colorado Springs Police Department officer, sergeant, speak, and he was a former school resource officer, and he gave his personal experiences that it's more difficult to detect marijuana when students are possessing it or using it. And so they had bad experiences with that when he worked as an SRO. He also said this was a bad idea. I don't want to keep, I have plenty I could keep going, but I'll wrap up with this. A couple weeks ago, I had lunch with a gentleman from Denver. He's a businessman up there, been very successful. He knows former and present city council members of the Denver City Council. And he told me that he was recently met with one of them, and I won't say whether it's current or past city council member, and that council member said they would not move to Denver now. That's how bad they think it is up there. That person's spouse will not go downtown. And if that person was moving to Colorado now, that council member, Denver council member, they would move to Colorado Springs. And I think we want to keep that. Thank you.
Thank you. Yes. Commissioner Gonzalez.
Thank you, Dr. Turbush. Appreciate all the comments thus far. I will highlight, and probably be highlighted later, so the El Paso County Commissioners did pass a resolution yesterday also opposing 300 and 301. Some of the comments I mentioned yesterday, I do consider myself one of those experts in this area because I did 10 plus years as a counter drug official with the Air Force over my course of the military, and then at Northern Command as a civilian. I participated in working groups where our published findings were included in the Office of National Drug Control Policy, so at the most senior levels nationally, and then participated and worked in the areas, the source country for a lot of drug-related production, and then did see some of this translate over to criminal organizations and cartels. So that's the aspect on the crime. The correlation is there, as was also kind of touched on. We see how criminal organizations will use legal avenues for their gray market and also black market for other entities. If there's a market for something legal, they'll utilize that same venue for their illicit fentanyl, and I'll mention in a minute with the coroner's report from yesterday. So the correlation is there, the concerns are there at the criminal level. I kind of want to focus more on the public health because that's really our aspect here. So I'll highlight that. The correlation there exists. We've seen it, as was mentioned. The emergency room visits have increased because of this. Where they are now seeing it much more with marijuana-related instances and in their bloodstreams, or in their bloodstreams, and then also seeing it for the fatalities and driving accidents that we're continuing to see. And most of concern is the last several years, as was reported in the coroner's report yesterday, is again correlation where we're seeing a lot of the deaths and suicides. We're again seeing marijuana as a correlation to this. So it's very concerning to see this increase, and so we want to talk about it. And was also mentioned how this affects our youth and the brains. As we all know, I think reports, the brain is not fully formed until about 25 or 26. And we're starting to see again, as was already mentioned, how this can affect our young adults. And that's something you can't just stop smoking and then have that recovery because the formation it's almost too late at that point. I mean, there's certain things that can happen, but great concerns on the health aspect, and I do want to highlight that aspect here today because that's what our realm is. But great concerns that this is going to continue to hurt the health and wellness of our community. And as was already mentioned, we don't want to see this great community slide to a community that we're starting to see in other areas where it's been legalized. Thank you.
Lauren?
I just want to support what Councilman Donaldson said and Commissioner Gonzalez said, and I do know that in my heart it would be disastrous for our community, and really if we are a board of public health, and because of that I think we need to support this resolution, and I'm proud to do that.
Thank you. Dr. Boone.
Thank you. I also agree with all the comments. I want to reemphasize that I think that use of recreational marijuana will have a high negative burden on the health of our city. Thank you.
Commissioner Bremer?
Yes, thank you. Similar to Commissioner Gonzalez's comments, the ability to be a strong leader and board member is understanding the capacity at which you're at the table and why you're at the table, and understanding. I think for several of us that are elected officials on other bodies here, understanding that. What the difference in kind of staying in your lane and still being able to be a strong leader is. And I've been a strong proponent all along of, I think we saw the detriments of boards of health across the country, not necessarily this one, being pulled into extremely political situations during COVID. And so when this first came up that we would approach this, I'm obviously a strong supporter of opposing legalizing recreational marijuana use, but I wanted to ensure that this Board of Health didn't really get out of our lane, and that we did have the data behind it to make a statement based on the health of our community. And I feel like this resolution really struck that balance. And I think it's wonderful that other boards, even that I serve on, have been able to make kind of the political statement on it, and that this is about the health of our community today, and it's the right thing for this Board of Health to pass this resolution. So I appreciate the the legal dance it took to get the words just right here. I appreciate the contributions of our medical professionals in the room, the body of research that is referenced both in the 2014 resolution and in this one as we learn more every day. This is the right thing for this board to pass today, and I appreciate the attention to detail that went into making sure the words were right for this board to not necessarily politicize an issue, but to be able to be leaders on something that affects the health of our community.
Thank you very much. Trustee Stevens.
One of the things that makes El Paso County, from Monument, where I live, down to Colorado Springs and Fountain, so attractive is not just the beauty of the environment and everything, but we're a family community. And I believe that we cannot put our children at risk by adopting something like this. We are fooling ourselves if we believe that this marijuana will not get in the hands of our children. Teens 12 to 7 who use marijuana are twice as likely to advance a substance abuse disorder. Colorado teens are more likely to drive after using marijuana than to drive after using alcohol. The high THC potency is associated with higher risk of schizophrenia, psychosis, and generalized anxiety. And then the exorbitant cost of these addiction treatment is more than most families can afford. I believe it is wrong choice for us to go down this route to try to approve or legalizing marijuana. I'm in support of our resolution today, and I encourage the public not to vote in favor of these ballot initiatives. I believe it's imperative for us, and this board spends hundreds of thousands, if not close to $1 million, trying to help people get off of addictions and deal with their addictions. And now there is an initiative that's basically fighting us. I don't know. We were talking about grants earlier. I don't know if that would jeopardize our grants. That we're basically a community that would encourage something like this. So I think for the sake of our children, let's not, I guess the argument in favor of this is that we get tax dollars. But let's not sacrifice our children for the tax dollars. I believe the ultimate cost of what it will do to our families, of what it will do to our children. I had a friend who told me, well, it's just my problem, just my addiction. And I said, have you talked to your wife to see if it is? Have you talked to your children to see if it's just your problem? An addiction doesn't just affect you, it affects everybody around you and the way you behave and things like that. So please, I encourage everyone to vote no on these ballot initiatives, and I am supporting our resolution today. Thank you.
Thank you, sir. I'd also mention that we had two, not one, but two county attorneys involved in scrubbing this. Thank you very much. Ori, and thank you, Kenny Hodges, for going over every line and every word. Director Whelan, any comment at all about this? You have a robust report, I know, to follow.
I don't have any comment, thank you.
Okay. All right. So, any other members of the public that we might have missed or overlooked? How about online? Anyone out there wanting to comment? No, okay, well, this...
Dr. Turbush.
Yes, please.
Sorry, can I have one do-over?
Absolutely.
I think it was the right thing to do to combine this, but I don't want it to be lost that October is Drug Prevention Month. And I really also appreciated the reference to all the other vices that our community struggles with in reference to this. So I don't want to lose the fact that there's a much bigger picture to this too. It's not just about the marijuana. That's certainly something we should speak out on, as I've said. But there are so many other things that this proclamation also, this resolution also says about the health of our community.
Well, thank you for noticing. Yes, we didn't include those along the way. Okay. Well, this combined proclamation resolution has been moved and seconded. We'll go ahead and go around the table. Councilmember Donaldson.
Aye.
Commissioner Lojinos Gonzalez.
Aye.
Yes, Doris.
Aye.
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 And I vote aye, so it's unanimous. And thank you, everyone, for their comment. As I mentioned, we have a very robust director's report today. So thank you, Susan, for getting back here overnight. I appreciate your dedication to being here in person. It's a little different when it's remote. But please, Director Whelan, go right ahead.
Sure, thank you, Dr. Terbush. I have a few different topics that we're going to cover. I'm sorry, cover. I'm thinking about addiction. My mind is getting ahead of me. We are going to cover substance use prevention among youth, some activities, and then talk a little bit about infectious disease and specific to COVID. And then we're also going to present some information on water treatment and reuse of water, because I know that has been in the news, and I'd like to provide an update on that and just, any local impact perspective. So with that, I'll go ahead and get started. What I would like to do is call our communities that care team up to the podium. Kimberly, I saw you earlier, if she's still with us. Becca, I see, and then Emma, please. And if I've missed anyone, please let me know. And I also acknowledge anything that we do includes support of our communication office, and there's some members here in our public health information officer, because what good is information if you don't share it or you don't promote it and people don't take note. So in the realm of substance abuse, we do have a community health improvement plan that two of our top two priorities that the community decided was mental health and wellness and substance abuse prevention. And so we do fit into that. We focus our grant initiatives and funding efforts on that. So back in 2014, we were able to secure funding to address youth substance use. And back then, our top two concerns among youth were suicide and substance use and abuse. So we are fortunate to have some grant funding that supports the communities that care. And I would also like to acknowledge Commissioner Lojinos Gonzalez, who is a key leaderboard member. And I used to be, and hopefully we can get back into some of that in 2014 when we started this together. But we focus on education and primary prevention. And I want to commend the team for the work that you do, because this is just a really small snapshot of all that you do. But we are holding a couple of different events in Fountain, the city of Fountain. And if you could change the slide, please. Thank you. In your package, you will have, and we'll have flyers for you as well. And I know Commissioner Gonzalez has been promoting this. But we are pleased to partner with our school districts in the city of Fountain and using our new Public Health South building, which you all approved the purchase of and is getting good use. And as time goes on, we'll have more events and more services provided at that building. What I would like to do is just have one of you three step up to the podium and just give the details on this, and then I'll go to the next event.
Great. I'm Becca Barnhart. I'm a prevention and policy specialist with El Paso County Public Health. My other job title, because it's very long, I am a community mobilizer for Fountain Valley communities that care, that was just spoken about. So as you've already mentioned, this is a community conversation that D8 and D3 partnered on with El Paso County Public Health to speak on, honestly, the dangers of fentanyl. This is a huge issue in El Paso County, but my sole focus for my coalition is the Fountain Valley, which includes District 8 and District 3 school districts, excuse me. I'm really excited that they put this together, and I'm even more excited that I was asked to speak on the panel of this. The agenda includes kind of talking about the dangers of fentanyl, real life stories that pertain to it, to add kind of that depthness to it to show that this is happening in our community. And then there's also going to be some experts talking about mental health, because as we know, they all do correlate and overlap together. I will be the last on the agenda talking about Fountain Valley Communities That Care and our initiatives that work to address and prevent youth substance use. Two, as already mentioned, our two focuses are cannabis and prescription medication, so that is why we fall within this conversation. And that's it.
Thank you, Becca. I appreciate that. And you'll see also on the flyer that it will be live streamed. I'd love to have any board members participate in that event. We have some conflicts with schedules because before we were working on this, we became aware that our own Michelle Byerly is recognized as one of the finalists for the Young Mayor's Award, Mayor Sothers Award. So that's an event, and I'll be at that. But we will get a good turnout at Public Health South, and I'm just thrilled that we're partnering with the schools. And I want to note that this partnership is not because there's more substance use in Fountain. It's because the leaders stepped up quickly to work with us, from law enforcement, the police chief Heber, the city of Fountain, the council, the school districts, the administration. And together we can accomplish more. So this is just one small result of that. So I'll send you an invite, put it on your calendars, and if you can attend, that would be fantastic. Even if we were able to get one or two board members, and we can post the meeting publicly to meet the sunshine laws as well. So the next event, if you can change the slide, please, focuses on prevention, and we partner with the Drug Enforcement Administration and routinely, and this is another drug take back day, as Becca had stated, that and you all are fully aware and engaged that we are concerned about fentanyl, especially with our youth. You can think that you're experimenting and one time will kill you, and it's extremely concerning. And so what we can do, we can take action and look in our cupboards and ask others, friends and families to let them know, take an active role in prevention in our community. This is a drug take-back day that is very easily doable. Search your cupboards and bring the medication that you're not using. And there's more details about what is involved here, but that is on a Saturday, October 29th, and I'm sure that we'll do more in the future. And there are some links on our website, too, with kind of the standard places where you could always take your medications back whenever it is convenient for you. But this is a effort that we are promoting and trying to actively engage folks. And how about Emma or Kimberly, you want to say anything about this that maybe that I've missed?
Sure, thank you. I think you covered it quite well. We're really excited about this. This is something we held in April and we'll be doing again. What's really exciting is we can collect a lot of different substances, any unused or expired over-the-counter and prescription medications. This is not necessarily our specific initiative, but the DEA's. However, we can also collect vapes as long as the battery is removed. And then something that's exciting is, although this is not approved by the DEA or necessarily something they do, we've partnered with other partners, and so we can also collect any sharps. And so we're just trying to expand as much collection as we can. And then something that Becca has worked really hard on is to make sure that when people come to this event, they can get other resources. So they can learn where they can be dropping off medications throughout the year, as well as other types of prevention initiatives that they can take. So I'm really proud of Becca's work and our coalition on this.
Thank you so much. And we routinely partner with the City of Fountain, the library, and that's where it's going to be held. And it is on October 29th from 10 a.m. to 2 p.m. And if you're not able to make that, then we also have some links on our website that proper and safe disposal, because we're not wanting people just to throw them out in their trash or to flush them down the toilet, those kinds of things. So this is an opportunity. So thank you for the work that you do. We've got a youth group that focuses on substance use prevention and peer-to-peer. So there's so many efforts that are going on, and this is an effort that you all did approve in a couple meetings ago for the grant funding. So thanks again for all the work that you are doing, and we'll see you at some of these events. So thank you. Any comments or questions about this before we move on to another topic? I'm not seeing any, so we'll go ahead and move on. Thank you. Next up is infectious disease, and wanted to give a couple of updates around COVID, and then I'll ask one or both of our medical directors to come up, because I know that there has been some information in the news regarding certain studies and vaccine. But I did want to mention that on November 9th, our mass vaccination site at the Citadel will be closing. And as has been mentioned here before, that it's not normal to have mass vaccinations drive-throughs. I mean, we did that because we needed to ramp up, and we are working with the State Health Department to close that facility, but that will be November 9th. However, there will be testing for COVID that will be run through the rest of the year. And what we really promote in public health on non-emergent times is we want people to have a medical home. That is really providing the best care. Now, for public health, we're more population-based, and I will say that we do have clinics that do a phenomenal job of flu vaccinations, COVID vaccinations. So we are a resource, but I did want to mention that mass vaccination site will be closing November 9th. I also want to mention that just when we're talking about vaccinations, that you all are fully aware that we did not locally issue or authorize any vaccine mandate. We focused on education and accessibility and people making their decisions to be vaccinated. So wanted to make sure that there's a refresher so there's not misinformation out there around that. I would like how about Dr. Mayor, if you could come up, and I mean, there's been, different publications or information and bits and pieces, and I think it's best for us to hear from our medical director related to some current vaccine information on COVID. Thank you.
So the first thing, the COVID update is pretty brief. COVID right now is doing fairly well. Our case counts are not up significantly, and our hospitalizations are also not up. So that's the good news. The bad news is whenever we see that, typically we see vaccine uptake decrease. And so we're still trying to get that message out for people to get their bivalent boosters and to get their flu shots as well, because we are seeing a slight uptick in flu. Not significant at this point, but definitely coming up a little bit. And then, as you all know, there's been a lot in the news about vaccine and vaccine safety. And I think a few things. One is to reassure you that we take all those reports very seriously. When new reports come out, we pore over those studies, we pore over the data. Dr. Albanese has, very advanced analytical skills and helps us understand those studies, as does Fadi, our senior epidemiologist. So we do take it all very seriously. I hope you appreciate that. There's nothing currently that is in the literature that suggests that we should change our public health policy regarding vaccines. And I think that's the basic message. I'll mention that there was a recent study that came out, and I think the most important thing I can tell you about that study is that the authors of that study were very careful. I think they did an excellent job of stating their limitations. And in their conclusions is that the study was preliminary, used based on surveillance data, and should be used with a great deal of caution. The only reason that study rose to national significance is there are people who chose to not use that study with great caution and chose to change public health policy based on that. But I don't see anything in that, and as a department, I think we don't see anything in that that suggests we should change our health policy based on that. But we're happy to take questions if you all have questions.
Are there... Okay. Thank you, Dr. Mayer. I also wanted to mention that, some of the, best prevention also is staying home when you're sick. As we think about influenza and flu and flu vaccines. So like if you're sick, please stay home. And we definitely are promoting that in our our work environment. So wanted to add that along. And we had a successful event last night, and I think I saw our immunization program manager, Christy Durbin, here. I don't know if you could just stand up and say hello. But I like you guys to get to know some of our team members because they are just, just so wonderful and so dedicated to public health. But we vaccinated 73 individuals last night with Boo to the Flu and partnerships with our District 49 school districts. So we're steadily engaged and involved with our school districts and so many different partners with so many different efforts with public health. So I did want to say that, it is influenza season, and our clinic does offer flu vaccinations as well as there's flu vaccine in the community. Always, if you have special situations, we promote going to your medical provider and seeking, that advice through your medical provider. Any questions before we leave the topic of infectious disease, because we're going to shift to water quality? Okay, seeing none. Kat, if you'd like to come up, I'm not sure if you want Harmony to come up, or I see you, Melissa, as well. We are going to talk about the water treatment and reuse. I know that there's been numerous different publications, including our Gazette, related to reusing water, and I'd like you to provide an overview of that and any local impacts, please.
Yeah, absolutely. So first of all, I thank you for allowing me to be here. My name's Kat McGarvey. I'm the Water Quality Program Manager for Public Health. This is Harmony. She's new to the team, and everything you've heard today relates to what we do, right? We've heard population growth. We've heard prescription drug use getting into our water systems. So in environmental health, we cover a lot of those bases. And if we're doing our job right as environmental health specialists, you don't know we exist very often. So I think that leads to a lot of a lack of understanding in what happens in water treatment and how water is used. So when we talk about water, drinking water specifically, much of that's regulated at the state level through the Colorado Department of Public Health and Environment and the EPA. Drinking water comes from a variety of sources. It comes from rivers, streams, lakes, reservoirs, so surface water. It also comes from groundwater aquifers. In fact, much of the water that we use today as drinking water supplies is hundreds of years old and can be hundreds of years old as we pull those through the aquifer. So when you talk about drinking water supplies and surface water, that water is exposed to environment every day. There's lots of things that happen to that water. We as humans impact the environment around us, and that impacts the water source. There's also wildlife that impacts and uses those same water sources. So there's lots of areas for those water sources to be impacted, as well as water we put back in the ground through on-site wastewater treatment systems. So all of that water is regulated through the state and the EPA. When we talk about that, you've got all of those different things impacting how we pull water and use water. Most of the drinking water is so highly regulated and requires a significant treatment process before it ever leaves that water facility and makes its way to the pipes to your house. For private lots, those that are using wells directly themselves, that water is less treated and comes directly out of the ground and out of the aquifer. However, most community systems are mixed. They have a high mixed water concentration, meaning we get water from all over the state, as well as through wells and that surface water that they've used. So we have a lot of processes in place that are set to protect this water source before it ever makes its way to the home. Most of the water that we use also has a certain percentage that must be put back into the environment. Typically that comes through wastewater. So once you've used water, the wastewater is then generated and it's pushed back to these community facilities. They have to treat that wastewater to a certain minimum standard before they release it back to a stream or surface water source. Once that water is released back to that surface water source, it's then moved downstream and used by another entity or pulled back out of that surface water source for use somewhere downstream. Same thing with well water and on-site systems. If I own a property and I'm on a well and on a septic, which is more appropriately termed on-site wastewater at this point, treatment system, to focus on that treatment. When I generate wastewater from a home on a well that goes through my on-site system, it goes back into our groundwater supply, which is why we have a 90-page regulation to help protect that water source as it's re-entering that groundwater supply. So your neighbor downstream pulls that water through their well, and then they can reuse that water in as safe a manner as possible. In one of my training courses, there's a stat that's routinely used that from the time water makes its way from the mountain stream to the ocean, it's passed through a human body a minimum of 7 times. So there's a reason these regulations are very stringent and exist. So that process of using that water, putting it back in the ground and being reused later, is sort of an indirect reuse of wastewater. However, the topic in the news has been direct reuse. So community systems using wastewater that's been generated from a larger population, treating that to a higher standard and putting it back into the drinking water system. So that would be direct reuse, is where you're taking known wastewater and putting it back, treating it and putting it back into your drinking water. So it's already happening. It's already commonplace for this to happen. This is just now more awareness and more, oh, it's really happening within our treatment systems. Next slide. So Colorado Springs has recently, last year in 2021, run a pilot program for this. And the reason, again, we go back to population growth. Our water supply in the county, water, we can't just generate water supply. It comes from surface rains, those types of things. It's not something that we can just regenerate to do that. So we have to be creative in finding ways to be able to supply water to a growing population. So this is the Colorado Department of Public Health and Environment, has recently, through the Water Quality Control Commission, approved guidance on and regulation on how to appropriately directly reuse water. And it will evolve. It will become a larger process, more likely. It is very stringent and very strict. The EPA and the department take those things very seriously when you talk wastewater reuse. However, it's going to be needed. It's a technology that's usable that we can use to sustain future growth and water use. So while we think about wastewater, maybe being a gross factor to it, the regulations are such that it will be so treated, and it has to be treated for a number of constituents, a number of contaminants before it ever leaves that wastewater or that water treatment plant to make its way to their home.
Thank you, Kat. I appreciate that. Hopefully that was helpful, because there's been some features and articles, and I wanted you to know that how serious, we take water quality, and Kat and Harmony and their team, they're in the field daily. And I think, kind of a fun fact too, with El Paso County, we have one of the highest on-site wastewater system licenses. The number of licenses that we issue is one of the highest in the state, correct?
Correct.
So that is all I had for my report. Thank you. Oh, did you have a question? I thought you went like this.
Well, I could add, I have actually participated in the CSU, I don't know if it's what you call it, an RV, a truck that has done this and tasted the water. I was okay afterwards. There's
an end of one.
That completes my report, Dr. Turbush. Thank you.
Okay. Thank you. Any other statement comments from the Board of Health members?
I did forget one thing. I apologize. Strategic Initiatives Officer. We have been trying to recruit a Strategic Initiatives Officer, and I'm happy to introduce Dawn, who has been with us maybe a week or so. And this is through a CDC grant as well, but she will be helping us with our strategic plans because we're on a 5-year cycle and it's time to update those, and we'll align with the county strategic plan, which we are heavily involved in the component where it mentions health and safety. So Dawn, could you say a few words about yourself?
Thank you so much, Director Whelan. Good morning, President Turbush, and ladies and gentlemen of the board, and other community members and leadership and staff and others. My name's Dawn Wessenberg. As she said, I'm in my second week as the Strategic Initiatives Officer. Prior to this, I was with the American Red Cross as a project management professional and senior program manager for initiatives working with communities who were chronically affected by disaster. Prior to that, I worked as an advisor for the state of South Carolina in their Bureau of Public Health Preparedness, implementing strategies for more inclusive public health preparedness planning, particularly for people living with disabilities. I'm a prior Air National Guard public health officer, doing oversight of public health, environmental health, and occupational health, but my primary focus was global health engagement in the water, sanitation, hygiene sector, working in West Africa, particularly Liberia. I'm a certified physician assistant, still licensed. I went to the Army program, and I just could not be more thrilled not only to be a new resident of El Paso County, but also to be working with this dedicated team. So I really look forward to collaboratively working with our community partners, focusing on improving the health of the county. So thank you very much for the opportunity.
Well,
Thank you so much, Don.
Thanks.
Very warm welcome. Welcome aboard.
Thank you.
Thank you.
Ask one question.
Go ahead.
Dr. Turbush. Dawn, when did you go through the IPAP or the PA program?
I went through the IPAP before it was IPAP, sir.
Oh. What did you call it then?
Just the Army program. So it was.
All right. Well,
it was 96, sir.
96. I went through in 98. Yeah, 98. So.
I'll look forward to speaking with you, sir. Thank you.
Oh, again, welcome.
No. Commissioner Longinos wants to know if they lowered the standards in 98. I guess Dawn and I can figure it out.
All right. Let's see. Next meeting of the Board of Health is December 14th, so it's a little sooner than expected to clear away for the holidays. And any safe rounds? I'm looking around the table here. No? Okay, I'd entertain a motion to adjourn. Okay, we're done.